Okay. At a time like this where, not only in the healthcare field, but just across the globe, people are scared. How can a physician leader sort of control that fear within themselves to still maintain that position of leadership?
Yeah, and I can tell you that I've seen emergency rooms, I've seen floods, I've seen riots, and no matter what you've seen in life, no one is prepared or was prepared for this. So get to the acceptance level where you know that this is a challenging situation and you may end up making mistakes, but there's always a way to find out more info on best practices. So the CDC is issuing guidelines, but the challenge is our healthcare leaders are not using that information to trickle it down to every employee. I don't know what it takes to send a once daily email or text message to all the employees and keep them informed of the best practices in clinics. Ramp up your infection prevention and control. Collaborate with sanitation workers, trash pickers. You have to make a comprehensive team to ensure that you are not scared, you're not alone, and you're also doing the best for the team. This is the time where you have to realize the good values of a democratic system. And the fear is natural, but then you have to do your best and use all the resources available and make good teams. You need a communication team, you need an infection prevention and control team in your system, and they all have to be, the small teams have to come together and work with each other.
Okay.
And yes, each person has to practice their own. If you don't have a protective equipment, you need to go out in the community, make your own resources. Now we have people making masks and gloves in the community, and then you have to know your own social distancing limitations. And many of the behaviors that were being practiced now have to be curtailed. Like earlier, physicians would shake hands and nurses would give hugs. So you just have to be mindful of what's new, what's happening, and realize that every day there will be a new challenge. So stock up on your energy, sleep well, eat breakfast, eat good food, try to get some exercise somewhere so that you are prepared for the next challenge. And I find each day challenging also because there's a change in protocol, the number of cases, shortages, material deprivation. So you cannot assume that the next day would be the same. It could be another change in practice, change in your climate in the facility, and you have to be prepared, and maintain your composure.